Vision impairment is a silent epidemic affecting at least 2.2 billion people worldwide, with a staggering 1 billion cases preventable or unaddressed. Even more shocking, 36 million people, or 5% of the global population, are blind. The primary villains: uncorrected refractive errors or near or far-sightedness, along with cataracts and glaucoma. Those aged 50 and above are the hardest hit, making up 80% of the visually impaired population. Closer home, India bears a heavier burden. The nation is tragically known as the blind capital of the world, housing an estimated 25% of the world's visually impaired. Over 6.2 crore Indians grapple with vision impairment, 13% of those living without sight. Cataracts are the chief culprit, causing 62.6% of blindness, followed by refractive errors and glaucoma. Amongst India's diabetic population, 2 crore face vision impairment, with 11% of those completely blind. Prolonged screen time is another burden, with 23% of India's population, or 27.5 crore people, suffering from weakened eyesight. Children are not spared either. Approximately 80 lakh children under the age of 15 are visually impaired, with near or far-sightedness being the most common issue. The prevalence of myopia, in fact, amongst urban children has increased for those aged 5 to 15, from 4.44% in 1999 to a shocking 21.1% in 2019. But the crisis doesn't end there. Conjunctivitis, age-related macular degeneration, eye injuries, dry eyes, eye strain and squints also plague millions. Today, we are honoured to have two of the foremost experts in ophthalmology, Padma Shri Dr. Natrajan and Dr. Sujal Shah, to shed light on these critical issues and offer hope. Welcome to the show. Dr. Natrajan, let's start with the most common vision problems that Indians face and which you encounter in your practice.
The most common encounter is, as you rightly said in the introduction, the refractive error, uncorrected refractive error. That means every child should, by the time they go to school, even at the age of 3, we can check the vision. And if there is a need for refractive error, they should correct it by a simple glass. So sometimes the children are condemned that they are not studying well because they can't see the board. And not keeping them in the first row is not the answer. Check the eyes and give them glasses. The other common condition which I deal is a retinal problem. Particularly India, we have 100 million diabetics. In them, 58 million do not know they have diabetes, and among the rest 42 million who know they have diabetes, they don't know that eyes can be affected. So diabetes affects the small blood vessels of the brain, heart, eye, kidney and feet, and eye is the window of the body. So if you can take a retinal examination or a photo, many diseases can be diagnosed. So that's where they, as a diabetic, they should check their eyes, which they are not doing. You should know if you are a diabetic, you should check head to foot, and also have the eye examination periodically. Don't wait for the complaint.
How regular should your eye checkup be?
So usually I always suggest, if there is any change where the mother looks, when the child cannot look at the mother, that's the time they should take the pediatrician and the ophthalmologist. And then definitely before going to play school, then before going to the first standard, then if everything is normal, at the end when you go to high school, that means the 6th grade, and then when you finish school, this is for a normal child, where and up to the age of, once you join at the age of 18, usually everything is stable. So you don't have to do every year. But if you're having myopia, you should check 1 out of 10,000 may have retina problem. The eye should be examined thoroughly. And if you are wearing glasses every year, and if you have symptom like sudden black spots or flashes of light or side vision problem, they should go to an eye doctor, because they may not know that time whether to go to retina, but they can go to any eye doctor and they should refer the patient if there's any doubt to the retina surgeon.
Okay. Well, Dr. Shah, you know, what really stood out to me was that the statistics of cataract in India, 62% have cataracts and vision impairment due to cataracts. Why do we have such a high rate?
So I think one is age. So it's an aging population. We have increased life expectancy. So we have more risk of age-related problems like cataract. We are a tropical country and very high exposure to UV light. Then nutritional deficiencies and access to healthcare, especially in rural places. So they are not able to go for early screening. These are some of the common reasons why we have such a high rate of cataract. in India.
What would the early signs and symptoms of cataract be, which one should be aware of?
Early signs would be blurred vision, things appearing out of focus, colors appearing faded. At night, if you're going out and there's a oncoming headlight, you would get glare from that. You might see halos around it. These would be some of your early signs of cataract.
And when should one get screened?
I think after 40, it's a good idea to screen every year at least once for cataract as well as glaucoma or any of the other retinal conditions like Dr. Natrajan has said.
Okay. But can cataracts be prevented or, pushed down further?
Unfortunately, there is no prevention for cataract. Though research for this has been going on for many years, there is no prevention that is possible for cataract right now. But what can be done to delay progression is, like I said earlier, UV protective sunglasses, a healthy diet. If you have any major disease like diabetes, hypertension, cholesterol, then have these things controlled. Keep a healthy diet and go for a yearly checkup
Okay.
to find early signs of cataract or any other concurrent eye disease.
So what would you recommend when it comes to a check for your retina, and what are probably the most common diseases that you see of the retina?
Yeah, so one is continuation of the diet. I think that the diet has a big role. So one is low fat diet, that means the green leafy vegetables, and which contains what Dr. Sujal said, lutein and zeaxanthin, which will help to prevent age-related macular degeneration. They have said 25 to 50% can be reduced with the additional rare elements like zinc, then selenium, and some rare elements, omega fatty acid, all that, which will also help in preventing a lot of problems for the eye. And as I said, every myope needs a retina checkup. This people don't know. So Lasik is mainly for, now anybody can get it done, but provided we do all the evaluation of the cornea, and we train from, we check the whole eye. That means the length of the eyeball, and because the length of the eye is longer, there's a probability of 1 out of 10,000 to have a stretch phenomenon. That's where if there's a hole, we can do a laser around it so that you can prevent retinal detachment. Even though it is 1 out of 10,000, for that one, they may go blind. And second is, once you are diagnosed diabetes or hypertension, you have to check the retina once.
How often?
Every year. When they are normal, every year. But the changes start, then the doctor will tell maybe sometimes a very advanced stage we have to do daily treatment for a week, then every month for a few months. And if it's age-related macular degeneration, once the problem starts, we have to check every month. We can give a newer anti-VEGF injections, which we can treat the complication of age-related.
But that's not something that can be prevented, right?
That's what prevented is by taking
diet.
this antioxidant, by taking low-fat diet, and genetically we don't know because there's a lot of research going on. So genetics also, for example, the parents have, I recommend if every diabetic when they come, I ask the son, have you checked your sugar? He may be only 30. So I said, it's a good idea to do HbA1c every year so that the day he becomes, then he knows 10 years he was normal, and then 10th year he becomes diabetic, then every year he has to check the retina, which is not happening. In diabetic retinopathy and age-related macular degeneration, we give a chart called Amsler chart, which is there in the net, which we can download it. And you cover one eye, see that center, and see whether any line distorted, which unless you close one eye, you don't know whether other eye is normal. So people don't do it also. That's why when you go for a routine eye checkup, definitely the optometrist and the eye doctor will cover one eye, check the left eye how much, cover the left eye and check how much. That is important to do it every year. It's like checking your weight and also the hip measurements for specifically to prevent diabetic retinopathy.
Okay, but someone without myopia still needs to get their retina checked regularly?
Yeah, that's what. They need a checkup when they go to school,
a regular check.
Then go to college, that means at the age of 18. And then again, after the age of 40, definitely they have to check every year.
One other quick comment is that protection from UV light will also help to prevent progression of age-related macular degeneration.
Is it a myth about carrots and eyesight?
No, carrot has a role to play with beta carotene, which has a role in the biochemistry of the retina, which is if you don't take, and if you have vitamin A deficiency, they have night blindness.
Okay.
One is a genetic one, but that is till the age of 5 only. But after that, taking carrot will not help in any other thing like myopia or cataract or anything. But it will definitely add. But carrot, because of the beta carotene and also the amino acids from even the fish liver oil olden days, which had, but that's only for the vitamin A metabolism, which is there in the layers of retina.
Dr. Shah, one of the big topics that we need to discuss is the prolonged screen time, not only for children but for adults.
Adults also, absolutely.
How detrimental is it? And when you define screen, is it any screen that we're talking about? Is it phones? Is it laptops? Is it TV? What is the exposure as compared to before? How harmful is it?
I think, Ekta, you bring up an excellent point. It implies every single digital screen, from your phone to an iPad to a laptop to a desktop to a television. So when you talk about screen time, it is cumulative for all the screens. Like Dr. Natrajan said, when you're looking at any screen, you stare. So your blink rate goes down and you get exposure, you get dry eye. Your exposure to blue light increases. That can affect your sleep pattern, especially if you are exposed to a lot of these screens 2 hours before sleeping. Very often as we are staring, our posture changes. So the ambient light in the room, the contrast, the background, the ergonomics of how we are sitting in front of our screens changes. So you will get neck pain. So it is not a disease, it's a condition. It will affect productivity.
Correct.
It will affect your efficiency when you work. You will get irritation, discomfort in the eye, you might get watering, some people get redness, some people will get accommodative headaches because when you're constantly focused on a near screen, you get induced myopia.
Okay.
And after focused near work, you suddenly look up and look at a distance, you might find things are a little hazy. So there are a lot of things that can happen. Most of these are reversible. It is not a disease that is going to cause any major problems, but it affects your efficiency.
So yes, sir.
Yeah, no, nothing. There's a New England Journal of Medicine is a high impact journal of ophthalmology, where they have reported 2 cases where the lady was using the mobile and turning one side and looking at the mobile, whatever video and everything for 15 minutes. And one eye was closed with the pillow. So only with one eye she was using the video, and there's no light in there. As you correctly said, ambient light is important because in the dark, the pupil dilates. The whole of the eye, and then here she is using the screen close to the eye, and that is also trying to constrict. So there is a spasm of the iris. They have reported transient blindness because of that in that one eye. For half a day or 1 day, she couldn't see, and 2 patients have been reported that. So fortunately, it does not produce total blindness or any blindness disease. As you correctly said, it's an occupational hazard, or even you can get a personal thing. So I think the main thing is we have a formula called 20-20-20. That means 20 minutes you look at the screen, and you have to normally blink, which is again people are forgetting. So I think earlier days it was involuntary, like breathing. But if you have seen, even breathing, when you go for exercise, the trainer tells you to inhale and exhale, particularly in meditation or in yoga, which we don't do normally. That's why oxygen does not reach the brain to feet. And
So
that's
20 minutes of screen and then 20 seconds
20 minutes you can watch at the screen, and 20 seconds you look at a 20 feet distance. That means eye will be relaxed when you see at a distance. When you see, whether you even read a book, see in the world, Jews have a lot of myopia in the beginning. Now Chinese have. All because of indoor activity. And then it's a chicken and egg story. Whether because you are reading a lot, you have become intelligent, or because you are reading, you are getting myopia. It was a big story, but now we have found out definitely using near vision a lot will strain the eye, because eyes are not meant for only near vision. The eyes are meant for distance
so
also.
how much screen time is good?
No,
or
you can do every time. That means every 20 minutes, you look at a distance. So that's why people recommend abroad and now in India too, where you have a glass door where you can look at the out. But people don't look at it. All the time, boss has given work or something interesting, they look here. Even when we operate in the microscope, earlier we were using microscope, now I use 3D, where I don't have to look at through the binocular. I can look at the big screen like this and operate, which is a good ergonomic design for a surgeon like me. But I think the main thing is to blink normally, which people don't do. You should not do more, you should not do less. But every 20 minutes, if you take a 20-second break, look at a 20 feet distance, your eye will be relaxed.
Okay.
That's why one of the reasons you play in the playground is to have the eyes relaxed. When you're playing football or seeing at a distance, eyes are always relaxed.
Okay. What about children then, Dr. Shah, and myopia?
So
And
all-
the relation to screen time?
All this applies to children also. I think we were discussing earlier, by the year 2050, it is expected that 50% of the world's population will be myopic or nearsighted. There's been a sudden increase in myopia in children because during this COVID time, all the children were exposed to the screen all the time, at least fixed 4 to 6 hours a day for all their academic work. Even now, it often continues in a hybrid mode sometimes or in a near mode. But increasingly, children are now exposed to screens. So, constant near work. People, even children, are increasingly on social media. Even on their, for their entertainment, they are looking at their phones or iPads. So, it's constant near work. Constant near work, less exposure to any sunlight or outdoor play or outdoor activities. Academic pressure increases, so they are really working till late night. When they work till late night, they are using their screens till almost till they sleep. So they have difficulty with sleeping because this affects the melatonin secretion.
Okay.
So their sleep patterns get disturbed. You're exposed to blue light, that also affects sleep patterns. So I think if we get children out to play during natural sunlight for at least 1 to 2 hours a day, and if we can minimize screen time to about 1 hour more than what their academics needs,
Okay.
I think that is a good
On a daily basis?
on a daily basis.
So 1 hour of screen time.
Whatever they need to do for their academics, they are going to do.
Yeah.
In addition to that, maybe half an hour or 1 hour is what you can allow
Okay.
for additional. And that is cumulative of TV, laptop, mobile,
And
iPad, everything.
from what age?
The later the age you can start, that is better. So after they are in secondary school or higher, that is better.
Yes. Dr.
No, during COVID, you brought out a valid point. Even for the adults, all started using Zoom meetings, even patients, counseling, everything was done. So I made a syndrome called WhatsApp vision syndrome because that comprises of near vision is the computer vision syndrome and the other is the digital eye strain. And then WhatsApp, everything they see through, even the TV or even the news, movie, everybody was started seeing in the mobile phone. And then many of the phones are small, except somebody who can afford iPhone 14 or bigger screen, or somebody can open. So that is little better than, but there is one devil better than the another one. But best is to play outside, which is what he says. And that's why, and then other thing is you read all the nonsense in the WhatsApp, which is also again straining the eye and the brain. So this is what I call the WhatsApp, and when I posted it, the Facebook banned it. I don't know whether they think it was against them. But the idea was to use the WhatsApp, but use it wisely.
Wisely.
So same thing, all of us are making groups and doing it. But I think you use for a few seconds and then do some other work. You will not have strain. Yeah. And recently, when I was talking to an executive. She's an HR head in a pharmaceutical. She told her daughter is 3.5 years and has -7, which is unusual. Then I asked her what happened. She says from the time of birth, both were working from the computers on work from home. Almost 3 years, and gave the phone from the almost from the 6 months of age to play with the mobile iPad, and she's got -7 now. So I mean, now we have a drop called atropine, where we use 0.05%, should be prescribed by a pediatric ophthalmologist, not by us, where they monitor the child for the length of the eyeball, as well as the drops will help in preventing myopia, but not after 7. You should at least be 0.5 or 1, then you can control it. Maybe they can use the drops up to the age of 15, and then play in the daily. I think you will not need glasses at all.
Dr. Shah, Lasik then, who would you recommend it to, and how much has technology progressed, and what's the youngest age that you can probably do the surgery?
So LASIK is a really excellent solution to to reduce dependence from glasses. You have to recommend this to people who are adults. So their number or the refractive error is stable and the eye is healthy enough to accept the treatment. So you do a thorough evaluation to study the corneal shape, the thickness of the eye, the corneal biomechanics, a CT scan for the eye, to ensure that this is safe for them in the long term, because we are doing LASIK for young people. Once you establish that the safety is okay, depending on the needs of each person or depending on specific things we see in the eye, under the broad umbrella of LASIK, we have something called surface ablation, LASIK, robotic LASIK. We have a new procedure called SMILE since 12 years, which is extremely safe. And we also have for extreme myopia something called as phakic IOLs.
Okay.
So we have many different solutions to offer people who want to reduce dependence on glasses. LASIK is one of the options, but when people talk about LASIK or laser, it's inclusive. It includes all these host of options.
Okay.
And some solution or the other can always be found for people who have glasses. Recently, in the last 12 years, even people who have weak eyes or a weak cornea, we can do strengthening procedures along with the LASIK to allow us to offer the benefit of LASIK to a wider range of people.
Okay. And Dr. Natrajan, you've dealt a lot with eye trauma cases, which is, complications due to injuries.
Yes.
Which are the most common injuries of the eye? How does it happen? How can it be prevented? And maybe an example of a case that you've resolved.
So the main thing is it happens in the school, playing in the road, in the street, then car accidents, then occupational, like in the factories, if they don't wear the protective goggles, and then a war also, where it may be a civil or a regular war now you see happening in Ukraine and the other, so war injuries happen, and so any injury can happen. That's why one is awareness, and when we are talking about glasses, I think now the entire optical industry have to think of using a glass which should not be breakable. One of the child in a school, they were a 7-year-old boy playing with another 7-year-old girl, dashed, and then it was a fiberglass only, but still it broke 4 pieces and cut the eye, and things in the eye came off. And then sharp object, another child wanted us to use a Swiss knife, and he kept the Swiss knife, and some guy came and put the knife over there, the eye went in like that. The part of the eye came in this hand, and the only thing I recommend is they should go to an eye doctor. And here it happened, he went to a big eye doctor in Mumbai only, and I even called the doctor because he told the eye is so badly damaged and part of the eye is in the bottle, so we'll remove the eye. I don't recommend. I represent all the International Society of Eye Injury Repair in the world, including International Society, and I'm the president of Asia Pacific. So we recommend, however bad, one is to prevent. Where car accident, wear seat belt, have the glass with whatever so that the glass doesn't break. And if you're wearing a regular spectacle glass, make sure it is not breakable. And even if it breaks, it should be cracked and it should not have a sharp this thing. And in factories, make sure the owner and the employee wears all the protective goggles required. And you need a PMMA protection. And particularly if you have lost one eye or you don't have one eye, like Patavudi, they should wear a sports protective goggles, which is not available in India, but it's a Canada certified and US certified with a standard design where it is made of PMMA, so that they can wear that when they are playing. And if it is only one eye, they should avoid contact sports like football, hockey, or even because somebody can hit. So why have so they can play that. I always tell them you can play some other game. Even shuttlecock can injure. Golf ball have hit the eye. So I have seen all sorts of injuries, including the pellet in Kashmir. So I think one is prevention, but if it happens, don't remove the eye. Whatever if one doctor says, better go to another doctor and find the tertiary care centers.
So what happened to that child, or both the incidents that you spoke?
So both the patient, we have saved the eye.
Okay, all right, Dr. Shah as well as Dr. Natrajan, it's been an absolute pleasure to speak to you all about eye health. And what we have gathered is that there is a huge amount of technological advancement which has taken place when it comes to eye care, and one must be aware of screen time and exposure. Thank you very much for joining us.